How does bilateral joint pain affect my disability rating increase? Attention veterans and supporters. A topic gaining traction recently is how bilateral joint pain influences disability ratings. Many veterans are seeking clarity on this important issue. If you have joint pain affecting both sides of your body, you may want to know how it impacts your disability rating with the Department of Veterans Affairs. Bilateral joint pain means experiencing pain in the same joint on both sides, like both knees or both shoulders. This condition is significant when it comes to disability ratings. The Department of Veterans Affairs has a specific rule for bilateral conditions, recognizing that they often have a greater impact on mobility and daily life than a similar issue on just one side. The Department of Veterans Affairs applies a bilateral factor when calculating disability ratings. This means that if you have conditions affecting paired joints on both sides, your rating may increase. For example, if you have a 30% rating for your right knee and a 20% rating for your left knee, the combined rating is not simply 50%. Instead, the Department of Veterans Affairs adds an additional 10% of the combined rating. So, in this case, the combined rating of 44% would receive an extra 4%, raising your total rating to 48%. This adjustment acknowledges the extra limitations caused by bilateral joint issues. This increase can have a meaningful effect on the compensation you receive. Veterans with chronic joint pain often find their ability to work and enjoy daily activities severely affected. A higher disability rating can help improve your quality of life. To qualify for this increase, you need to provide medical evidence showing that both joints are affected. The Department of Veterans Affairs will assess the severity of each joint's condition before applying the bilateral factor. For veterans navigating life after service, understanding how bilateral joint pain impacts your disability rating is essential. It can lead to increased monthly compensation and access to additional benefits. If you are experiencing bilateral joint pain, make sure to document your symptoms thoroughly. Seek medical evaluations that clearly describe the bilateral nature of your condition. In short, bilateral joint pain can lead to a higher disability rating through the Department of Veterans Affairs bilateral factor. This recognizes the greater functional challenges faced by veterans with pain in both sides of the body. This can result in increased support and compensation for those managing joint pain after their service.